When determining if an athlete is able to return to play, there are many factors to consider. It is important to make sure the athlete can perform specific skills safely and accurately before they can fully return to activity. The way we can determine this is with certain tests and assessments that are tailored to the athlete's needs. I am selecting the upper extremities and have designed a test that I will have an overhead athlete perform to see if they are able to return to play after a shoulder injury and/or surgery. This assessment will test the athlete's flexibility and range of motion of the shoulder and the strength and endurance of the shoulder muscles. To perform this test, the patient will stand up straight. They will hold a 1 pound weighted ball straight out in front of their body at a 90-degree angle. Next, you will have the patient perform 4 movements, returning to the starting position between each movement. First, go into shoulder flexion, move the arm straight overhead, and then return to the starting position. Shoulder extension, move the arm down and straight behind them. Lateral movement away from the midline, and medial movement towards the midline. These movements should all be done in a controlled manner. The patient will go through these movements a total of 3 times as one trial. 2 trials will be taken on both the injured and non-injured arm. The measurable component of this test will be based on an error scoring system. The clinician will count the errors the patient makes during each trial. More errors will lead to a higher score on this test. We want to have a low score and the least number of errors possible to indicate that the athlete is able to return to play. With this test, we will have the patient perform it with their non-injured arm as well to compare it to the errors of the injured arm. If the number of errors from the trials of the injured shoulder exceed more than 5 of the non-injured side, the athlete is not ready to return to play. Errors that we will be counting during this test are as follows: arm leaving the horizontal or vertical axis during the movement pattern, moving out of position, both upper extremities or body out of position to compensate, not returning to the starting position, fatigue, which is falling out of position due to fatigue, resting arm by the side of the body, or pausing during the test. Balance, being off balance in any way, will also result in an error. This test will also allow you to see if there are any specific shoulder movements the patient is noticeably deficient in. So for example, this is our patient going into shoulder flexion on her good arm, and now she'll go into shoulder flexion on her injured arm, and is way less range of motion. Now she will come across the body on her good arm, and now she will go across the body on her injured arm. Once again, you can see there's less flexibility and range of motion on the injured arm.